All right, great. So, like I briefly stated, today's call is hopefully to be able to, after today's call, be able to describe just all the different CSEP strategies and their programs, activities, to be able to describe the CSEP alternative strategy and be able to better understand how some of the local jurisdictions are implementing the alternatives strategy. Um, the like I said, the structure was to do a brief overview, and then we'll have the peer sharing. And we have time to have questions to each jurisdiction, as well as then if you at the end we'll have everyone that presented come on and be able to ask all of them together some questions as well. So we'll go ahead and get started with Rona.
Thanks, Nicole. Yeah, so like she said, we're going to go over the CSEP strategies real quick. All right, so we've gone over these before. So the first one is prevention education. It's a two-way approach to teaching participants important social skills like resisting peer pressure, looking at the intent behind advertising, and developing skills to make healthy choices. The next one is environmental. So environmental programs are aimed at the settings and conditions in which people live, work, and socialize. They call for changes in policies to reduce risk factors and increase protective factors. The next one is community-based process. This one you all know and love. This one is to strengthen resources such as community coalitions to prevent substance use and misuse. Organizing, planning, and networking are included to increase the community's ability to deliver effective prevention and treatment services. The next one is information dissemination. So that increases the knowledge and changes attitudes through communications. This method of learning is mainly one way, such as speakers or campaigns. And then finally is identification of problems and referrals to services. These are crucial to prevention of substance uses. This process includes determining when the behavior of people who are at high risk or who are using substances requires education or interventions. And then finally, the alternative strategies, why we're all here today. The alternative strategy provides for the participation of target populations in activities that exclude alcohol, tobacco, and other drug use. The assumption is that constructive and healthy activities offset the attraction to or otherwise meet the needs usually filled by alcohol, tobacco, and other drugs, and would therefore minimize use. Examples of ways to evaluate impact include measuring the skills the participants gain from the program, a number of opportunities to engage in pro-social activities, the connection between the community, and building protective factors for connection. You can measure the feeling of purpose and connectedness of the group in order to demonstrate how the programs improve protective factors. So there are a few examples that we have for the alternatives. The first one is youth-led groups, and then the second one would be skill building activities. So there are activities as compared to just one-time events that youth and adults participate in that specifically exclude the use of alcohol, tobacco, and other drugs. This can include leadership skill building, resilience, coping skills, sports, and so much more, where the emphasis is on the skill compared to focus on substance use. A major component to note is that none of these are a one-time event. The goal is to have a continuous program or activity to measure impact. Like we said, we're all here for a peer sharing call. So we ask ask the jurisdictions that are presenting today to provide us with the background, implementation, and evaluation, barriers and successes, and lessons learned, as well as next steps, so you guys can learn from each other and ask each other a bunch of questions so we can implement everything amazingly. And the 4 jurisdictions that are presenting today are Worcester, Montgomery, Carroll, and Dorchester. Our first county to present today is Worcester.
Okay, I was just about to ask, do I need to present? Okay, never mind. All right, are we good to start?
Yep, you're good to go, and just let me know when to hit next.
Okay, thank you. All right, so my name is Lynn. I am the AOD Prevention Supervisor at the Worcester County Health Department. We also have Kelsey Kingla and Don Richardson on the call, and they both help with the planning and the facilitation of the Youth Ambassador Program. All right, so you can go to the next slide, I guess. So this is just an overview. We're going to go over, like we already saw on a previous slide, the background, implementation, evaluation, successes and challenges, and then plans for the future. Okay, you can go to the next slide. All right, so some background on the program. We collaborate with the Worcester County Board of Education and Worcester County Public Schools to plan our Youth Ambassador Program every year. Previously, it was called our Peer Leadership Training. We've changed the name Youth Ambassador Program. Basically, what happens is 10 to 15 middle school and high school SAD members from every middle and high school. So we have 4 middle schools, 3 high schools, and their advisors will come to a Youth Ambassador Program that's in the fall. That's our first event of the year. The middle schoolers meet for 1 day, and the high schoolers will meet for 2 days. It's generally an outside event, so we'll pick. We've had it at Pocomoke River State Park, which is right down the road. We've had it at another Milburn Landing State Park, and then this last year we had it at Assateague. So we were at the beach at the state park, and that was the first year we did that. And I believe we're going to try to do that again next year. So it's a little bit tricky with the planning because you can't do it too soon into the school year, but if you wait longer, then obviously it's going to be cold outside. In previous years, like before maybe my first year here and then before that, they were doing it an overnight trip to Delaware, but we're trying to keep it in county, so any money that's spent is staying in county, and it's just much easier to plan this way, so that we're not having to go anywhere overnight. And then we have a mid-year retreat in either January or February generally, but because of the snow we've been getting, we've had to postpone twice. So our mid-year retreat this year will be in February, and I'll touch on that a little bit more in a second. Next slide, please. All right, this is just a picture of this year's program at the park, or at the state park on Assateague. We had really, really nice weather. It was actually unusually warm for October, so we lucked out there. So the first thing we do for implementation is we start meeting with the Board of Ed. We have a contact over there that we've worked with for many, many years, and we work with her on a lot of other projects. And we start to figure out what time or what a few dates that are going to work with us. And then she handles the permission slips and reaching out to the SAD advisors. So she's kind of like our liaison between the SAD clubs. Once we have that, we secure the dates. Then we start looking at what location do we want to go to. The only reason why we reached out to Assateague this year is because our original state park that we've been going to for years wasn't available. So this one worked out in our favor. We were able to kind of begin a new partnership with Assateague. We also work with Salisbury University, so we start some discussions with them because their communications program sends students to each of our middle school and high school events in October, and they talk about how to create an effective campaign. So one or two or a few of us will go over to SU and kind of give a presentation to those students and give them an idea of what we're looking for and what some of the outcomes should be from their presentation. So all those internal and external meetings need to happen. Internally, after we have the dates and the location planned, we start meeting about the breakout session topics. So for both middle school and high school, they'll have some kind of icebreaker. They'll have the communications presentation from SU. They'll have some kind of like team building activity. Last year they used like sea glass and shells and created like an art project that represents their SAD club. So something that's a little bit hands-on that gets them up and moving. We also did a scavenger hunt on the beach this year. And in the past, when we were at the state parks, we did like walks through the forest, and they answered AOD related trivia questions and things like that. And then we'll have breakout sessions. So we'll do alcohol and other drugs gets a session, tobacco and vaping gets a session. We'll do one on mindfulness, and then we'll have one on nutrition and healthy eating. So those are generally the same breakout sessions every year, but the activities will change. We'll prepare the agendas and then any other materials that we're giving them. If we're giving them any resources to take home with them, we'll make folders or we'll make bags for them. And then we will facilitate the program. Like I said before, middle school is 1 day. High school goes over 2 days. We just have more information to cover with the high school kids. And they also get time to meet with their SAD groups and plan their activities out for the year. And then they present that back out to the group so they can get feedback. And then afterwards, we have a meeting to review what worked and what didn't work. We start going over all of our survey data. And then we begin planning for the mid-year retreat, which again is usually January or February, but this year will be in April. Next slide. All right, at the conclusion of the program, we start going over, or the evaluations are given by their SAD advisors, and then we start going over all the data and making sure we touched on all the topics we wanted to touch on. I'm not going to read the questions on the right, but those are just some of the questions I picked out from this past October's retreat, some of the high school and middle school data. The mid-year retreat doesn't have the breakout sessions. We have done that in the past, but we feel like we gave them the information that we wanted to give them in October. So this year, what they're going to be doing is the theme of the retreat in April is going to be about puzzles. So they're going to create their own puzzles as a SAD group using some of the data and the facts that we gave them in October. And they're also going to do like an escape room activity with that same information. So they're getting the information again, but then they're kind of showing us what they can do with it so that they can go back to the schools and teach their peers the information that they learned from us. Next slide, please. All right, some of our successes. We had the new partnership with Assateague. That was great. They were really accommodating, and the space was ideal for what we needed it for. We strengthened existing partnerships, so with the Board of Ed, and then I didn't add Salisbury on here, but this is like the 3rd or 4th year we've been doing this, so we definitely have a good partnership with them as well. This year we got to go back to SU after the program. I think it was in November that we went, and we got to see the SU students presenting on their whole project and what they liked about it, and what they got out of the whole experience. And then, so the communications activity was a success. And then the evaluation data, it shows that the majority of the students learned more about alcohol and other drugs, tobacco and vaping, mindfulness, and stress management and healthy eating. And that was from the slide before. Some of the challenges are things we can't control. Every year, it doesn't matter where we have it, we get a complaint about the weather. So if I think it was beautiful because it was 70 degrees, somebody thinks it was hot. Or if we tell them that it's outside, so dress appropriately, they are teenagers, so there's a guarantee somebody's going to come in shorts, somebody's going to come in sandals, and then if it's too hot, then they're probably wearing sweatpants and sweatshirts. We can't control that. We can tell them that it's outside and that we hope that they dress appropriately, and they still don't. We get a lot of complaints about bugs. Can't control that. Spiders in the bathroom. And then this year, a new one for us were the sandburrs on Assateague. So if they walked off the path, which they were told not to do, onto the sand, and they got sandburrs in their shoes, we heard about that. So scheduling, it's really hard to find a date that works with us and the SAD clubs. And like I said before, you can't have it too early in the year because the SAD clubs haven't met yet. You can't have it too late in the year because then it starts getting too cold. So that's kind of a challenge. We have like the month of October to work with, and that's it. And you're also starting to compete with homecoming at the high schools. And it is kind of challenging to find engaging activities year after year because some of these SAD club members, if they started in that as a freshman, then they are going to do it for 4 years. So you don't want those freshmen to have the same activities every year. You want new activities with new information. So it is hard to be creative, but it kind of forces us out of our comfort zone a little bit. So I think we've done a great job of doing fun activities with new information, and they're always hands-on. We don't want them just sitting there, not moving around. Next slide. Right, plans for the future. So we do plan to continue partnering with Salisbury University so they can present about creating an effective campaign. We will continue to work with Assateague State Park to host our fall program as long as the dates align and the space is available for us. And then we're just going to start exploring the future themes for the mid-year retreat so that it's something that's engaging and interesting to them, but that they're using the information that they learned at the event earlier on in the year. And I think the next slide is just my contact info. Yep. So there's my information. And then again, you have Kelsey and Dawn on the call as well. So if you have any questions, you can always reach out to us.
Thanks, Lynn. Anyone from any other, here's the chance for you guys to learn from each other. So if you have a question, you can raise your hand or type it in the chat. Love to hear from some other jurisdictions to any questions. While we're waiting, I guess a question to you guys in terms of evaluation, I guess you kind of measured sort of the success of the programming, but what are for your alternative strategy, what's like sort of the main contributing factor that you're focusing on to like address, and how are you measuring that with this program or in your evaluation for it?
Well, we ask a lot of questions, but the main thing we're focusing on for the purposes of this grant, because we ask some questions in the evaluation that maybe don't have so much to do with prevention of alcohol and other drugs, but we're focusing them mainly on if they're gaining any knowledge about alcohol and other drugs, but also are they able to use that information and take what they learn and go back and teach their peers anything? Do they now feel like they have the skills to teach their peers? Because that's what SAD Club is all about. It's not just them coming to a fun activity. It's them getting new information and then going back and planning out activities for the whole year, because they are viewed as leaders in their school if they're part of SAD.
We have a question from Jackie. Jackie, do you want to ask it or do you want me to read it for you?
Oh, sorry. Hey, how's it going? No, I was just that's a cool program that you're doing. I was just curious. In our county, our youth do the planning and stuff, and so they have like input, into what they do. So I was just wondering, do you have the youth participate in any of the steps or planning or anything?
We really haven't. That's a great idea. My only concern would be the time factor again, because they've only probably met once. But that's definitely, we have a relationship with all the SAD advisors. So that's definitely something we could explore doing in the future, because if they know it's coming up, then that might be something they can work into their first meeting. Thank you for that.
Thanks for sharing.
Any other questions from the group? Oh, Rondalyn.
Good afternoon. Can you hear me?
Mm-hmm.
Awesome. Hi, I'm Lynn. I was just wondering, in your county, it sounds like you have a robust SAD program in all of the middle and high schools. Is that correct? So
Yes.
how has SAD been supported to maintain that level of those number of clubs and the work that they do? Because one thing that we've seen here in Baltimore County, more and more schools are abandoning their SAD clubs. And I know that Camry used to be the state organizer for SAD, and that is no longer something that is active either here in Maryland. So just wondering, how have you supported, or who is there that supports the facilitation of SAD throughout all of those schools?
So we have a contact at the Board of Ed. She's like the coordinator of instruction, and I think she handles like the arts and all after school programs and all summer programs. And she also is over the SAD clubs. So we have a good relationship with her, and they've had that relationship since way before I was here. So I'm not going to take credit for that relationship, but she supports the SAD advisors a lot. But I would say on our end, we reach out to the advisors on a monthly basis and offer them any kind of technical assistance that they might need in facilitating their plans that they created at the retreat. And we also go in, some schools are obviously more active than others. I can think off the top of my head of like 2 or 3 advisors who invite us in every year, multiple times a year, to do presentations to their either health classes or their SAD clubs about alcohol, tobacco, and other drugs. So you're always going to have the ones that are more active, but having that relationship with the Board of Ed, I think, is really important, because she is the one, they get a little bit of money. I mean, we are able to provide that money through our grants, but she distributes the money, and she coordinates all their meetings, before the year starts. But that has a big difference, I think.
Thanks so much.
Sure.
All right, well, thank you, Lynn and Worcester, for sharing. I think we'll go on to our next jurisdiction, and if anyone thinks of other questions, feel free to write in the chat, and like I said, we'll bring all the presenters back at the end. So next we have Dorchester.
Hello, my name is Kirsten, and I am from Dorchester County, and I am an advisor for our Youth Action Council. So our group is youth-led, adult-guided, and we'll get into what exactly that means in the next slide. So I'm ready. So first, we'll talk about our background. I'm ready. Our purpose, so this is like included in all of our brochure and handouts. The Youth Action Council, or YAC for short, is a group of middle and high school students, and they kind of act as a voice for the other youth in the county when it comes to creating positive change and growth. They exist because youth know best what it's like to live in the moment. They understand better their influences of the world that, promote the unhealthy behaviors we talk about, like bullying, substances, even sex. And they're living in that moment. And while us adults are kind of on the outside looking in, youth messaging is typically more powerful because their peers kind of see that as coming from each other. So I'm ready. The objectives of our group is to train, we call them peer influencers, on the harms of risk-taking behaviors such as substance use, in an effort to develop educational messaging for peers. And that looks like advertising, that looks like events. Oh, I have tons of examples of our events coming up as well. But we also foster leadership skills through community engagement. And this includes the development of monthly events that we host throughout the entire county, and we target those to youth and their families. And I'm ready. So I did want to highlight what we offer our youth members to participate in the program, because I think it's an important part of our structure. So our youth members receive a stipend for attending their regular meetings. So we meet twice a month here at the health department. But then they also receive service learning hours for attending events. So that includes setting up the events, helping us work the events, or even if we're not hosting an event and they come with us out in the community to some of our partner events. But they also get the opportunity to travel. So most recently in February, we took a couple of our youth members to the CADCA Leadership Forum. They spent the whole week there, getting some great information. They also have media training. We work with them to develop their written and oral communication skills, and they work as a team to develop the monthly events. So they get a lot of team building experience. And I'm ready. So next we're going to talk about our implementation. So, our successes, our barriers. I'm ready. So back before I started, the youth that were active in 2019 came up with a campaign called I'd Rather. And basically what that campaign encouraged was for young people to consider their positive activities that they like to engage in on a day-to-day basis that aren't substance use. So, they had the ability to self-reflect, how substance use would kind of hurt their ability to engage in these activities. So as you can see, the youth actually developed this logo, and we even have a mobile van that has the decal all over it, and we take that usually to events to kind of really keep it at the forefront of our group. And I'm ready. So as I said before, the group meets twice a month to plan monthly events. So some of our most notable events, we had a teen paint party last school year. It was a really big hit. We had a professional artist come and lead it, and really it focused on reinforcing, how expressive art can benefit mental well-being. It can be a nice way to de-stress. So the teens got to really engage with the artist, and while they were pre-drawn canvases, and they had the opportunity to paint them and make them their own, which was really unique. And they even liked it so much that our group this year has decided to host another one. So we are looking at that in the upcoming month. This past January, we had our second annual vision board party, where we invite all ages from Dorchester County to come and create their vision for the year. We provide all the supplies, and just give them an opportunity to set their goals, long-term, short-term, and really start thinking, forward of their future and where they see themselves. And then another event that we hold pretty regularly throughout the summers are our outdoor field days. So that van that you saw on the last slide, we'll take that. We travel through different schools, and we'll set up like in their big yard area, and we have flag football, we have giant Connect Four, various other like mega size games like Jenga. And it's always a really great turnout. We get all ages, and it gives us the opportunity to really talk one-on-one with them, and kind of disseminate some of our branded materials. I'm ready. Another big thing that we just did over the summer was bathroom beautification. So our youth identified that the bathrooms can kind of be a negative space. It's filled with a lot of hateful messages, graffiti, but it's also a space that a lot of youth kind of turn to for that moment of alone time when they feel overwhelmed. So we decided to transform that space into something that is more inviting, more motivational, and encouraging. So Dorchester County Public Schools allowed us the opportunity to start with the elementary schools this summer. So I've included some of the highlights from a couple of the schools we did. Now, our youth members were fully involved with this from start to finish. So they met with the artists at each school to kind of come up with designs. The artist was at the schools with them, did the outlines, and then the youth actually painted these. So it was very hands-on for them, and it was a project, to give back to their peers. And it was very fun. Like I said, we did the elementary schools this summer, so we're optimistic that we can get into some of the middle and high schools looking forward, to kind of bring this, wider. And I'm ready. As I mentioned, we took some of our youth to the CADCA Leadership Forum. So these are just some pictures from that trip. We took 3 of our youth members. They attended the full conference. They got to network and, attend different workshops to kind of build their coalition skills, and really like build that confidence of what they want our group to look like moving forward. And I'm ready. So when we look at our evaluation, like we look at the data, we actually went through like a significant restructuring. I came on right at the end of 2023. So before that, we kind of dropped off. There wasn't an active enrollment. They weren't meeting regularly. So myself and some of our co-advisors, we're really heavy in the recruitment phase. We did a few months of just being in the schools, attending the community events, really pushing flyers, brochures, talking to parents. And so we saw quite a spike in enrollments. We had 20 members last school year. And as you see, this school year, our members kind of leveled out. And it's not so much that our program wasn't favorable, but again, where we restructured that last year, we were given the opportunity to see what worked, what didn't, and we were able to kind of reel back a little bit and fine tune the program. So, we had a lot of 8th graders last year who now are 9th graders. It's a very overwhelming transition. So, they didn't necessarily come back because they have a lot of other things going on. So that was understandable. We also established a different process for re-enrollment. So when they reapplied, we would go through an interview process, and we would also evaluate their participation from the last year. So the 7 members we have this year are, we might have less members, but they are much more engaged, which we will look at on the next slide. So last school year, you can see that the outreach attendees, we really didn't have a lot of reach. And, that was because we had a late start. Again, we recruited a lot longer last school year to really put a name to our group. And where I was new and some of our advisors were new, we really just wanted to put ourselves out there and build that relationship. But then so far this year, our group has been extremely active. We've been out in the community, and they've really we've reached a lot of people. I mean, we capitalized on the schools hosting trunk or treats, and we were able to hand out lots of incentives and, really, talk to people as they came through. So again, even though our enrollments were lower, they were much more meaningful and engaged youth members. I'm ready. So some of the challenges that we faced, obviously the pandemic and staff turnover, so it kind of put a standstill to some of our ongoing and active members, like meeting regularly. So it gave us the opportunity for a fresh start. And, while that is an opportunity to grow, it comes with its own set of challenges. So, for myself being new coming into that, we had to reestablish a relationship with the school. We had that lengthy recruitment period to really build that rapport with students. And then we also had to rebuild community partnerships because it had been a while since we had meaningful partnerships. And again, putting a name to my face. I'm ready. So as we move forward, and I have some recommendations for anyone who has youth groups. I'm ready. So the things that we look at to measure our impact, now these are our indicators we include in our strategic plan, but I think that they're worth going over because we look at our collaboration. So, we're looking at how we're partnering with community organizations. We're looking at our YAC membership, but we're also looking at that participation level. We're also specifically looking at prevalence of 30-day alcohol use and binge drinking. And for that, we rely on the YRBS. We're in the process of getting another round of CTC surveys implemented. And then we also have our group is funded through a couple different grants, and so one of them requires a youth participation survey. So we kind of piggyback some of that data to see how youth are responding to our events, and what works and what doesn't. We also look at how often we're meeting versus how many events we're having. Is it efficient? Are our members attending the meetings? Are we getting a good turnout at the events? Again, looking at the partnerships and just making sure that we're moving forward. I'm ready. So again, looping back to partnerships, really the foundation of our program is partnerships. The youth bring us their vision for what they believe will be most beneficial to their peers, and we seek out our connections to make that happen. So, we partner with several organizations pretty consistently to host our events, but we're taking a bit of a different approach this summer. We actually are collaborating with the 4-H, and they have a evidence-based curriculum called Health Rocks. And so they will be training our youth members who will then turn around and implement that curriculum to 8 to 12-year-olds in their community over the summer. So it's a unique opportunity for them to be trained on an evidence-based curriculum and then be able to, have that personability with their peers and mentor a younger group. So we're really excited about that. I'm ready. So some tips that I have to share with you guys. really be patient. I think the biggest thing is that it's human nature to expect like that immediate gratification, but when you're working with youth, it takes a lot of time to build trust and to really get them invested in a program. And so, we found that even having a smaller group this year, having them have that passion can be more impactful than just having a lot of youth and trying to reach as many as you can within that group. And then let the youth lead. We can talk at them all day, and it's not as meaningful as it is when it comes from their peers. Because again, the youth have that unique perspective of being involved with those things that are happening, and they can create those meaningful messages. And a lot of times when you give them those tools to succeed, they can create an effective prevention strategy within that group to implement into the community. So definitely just be patient and steer them, but let them have those ideas, because it always ends up working out. And I think that might have been my last slide. Yep. So I didn't include my email, but I will gladly put it in the chat if anybody has any questions.
Thank you. Any questions? I guess while people are thinking of questions, my question is going to be always evaluation to start. But in terms of some of your other for evaluation measures, do you guys, I don't know, what is for that set, the other, what was it? The one that you talked about, the one survey that does that one participation survey, does that ask about like does that for the YAC members or the participants of the program? Do you have any surveys with the YAC members of like kind of assessing the skills they've learned and how they've been able to apply that just on them individually by participating in this program?
Yeah, so last year we did like just a quick survey of like their preferences, like what they thought would be most effective in their community. Now, right before I started, the previous prevention supervisor had partnered with the Campaign for Grade Level Reading, and they implemented a community-wide survey where youth were able to kind of voice how they feel, what were the big issues in their community versus like what were the protective factors, like were there activities for them available, do you feel like they're accessible, things like that. And so that was like what spearheaded our restructure. Now, as far as like implementing a survey for our members to kind of look back on that and say, did we do a good job? Last school year, we did not do that. But this school year, we are trying to have something once we get through like our last event in June, right before the summer camp, kind of evaluating. The youth participation survey I mentioned is for community members that attend events to kind of, again, maintain like a consistent feedback outside of our group to make sure we're on track with like the broader community and the things that they're interested in.
Great, thanks. And we have one question in the chat asking, how much do you pay them? What does that stipend look like?
Okay, so the stipend actually comes out of our True You grant. Like I said, our program is funded through a couple different, because all of our grants require youth components. So we've kind of divided our membership into, we teach them all of our topics in health education, but we kind of divide and conquer. So True You offers a stipend and the $20 gift cards. So they get those every time they attend a meeting, and we have 2 of those a month.
Any other question? Hillary asked, do you survey the students specifically on the substance use? So I guess for the participants and or the members, I guess, how do you, for that,
So I think most of our data for that comes from the YRBS data and like that community survey that I just mentioned that they had conducted.
So nothing directly with those that are participating to see impact?
Not currently, no. The youth participation survey is actually new. It's a requirement again for one of our other grants. So it was just developed for this fiscal year. So we haven't really had a chance to see if it works, if it needs some tweaking to kind of, get more information. Again, we the Youth Action Council has been around longer than I have been here, but in the last 2 years, it's definitely been completely restructured. So we're still having some growing pains, but I think we're definitely like on a good path.
Great.
And Kirsten, the context around that is I'm Hillary Gross in Frederick County, and we've been talking about fielding a survey directly to the students to dig deeper on their substance use to try to basically get more detail than the Yerbis gave us. So I was wondering, did any of the surveys you do involve that, or is that like a totally separate issue?
So like I said, not really currently that we've done. I know that Youth Action Council assisted me because we also received the cannabis grant. So we had an event under that grant that the Youth Action Council was at and participated in. I mean, we did do a survey at that event that did gauge, prevalence of substance use, both by the individual and by like peers, family members, like just anyone surrounding them, like how were they exposed to that. So we did have that specific survey, but it wasn't necessarily something that we regularly implement for the YAC events.
All right, thank you.
Okay, well, thank you. If anyone has any additional questions for Kirsten, put in the chat. And like you said, we'll bring everyone back at the end. So now we're going to move on to Carroll County. Back up. Yeah, there you are. Okay.
We can't hear.
Yeah, Becca, are you there? There you are. Oh,
All right, this is not good.
We can kind of hear you
Becca,
now.
we can hear you.
Can you?
yeah.
Okay, sorry. I wasn't getting anything. Someone was saying anything, so I thought you couldn't. All right, perfect. All right, well, hello everyone. I'll try this again. My name is Rebecca Rigney. I am the Substance Use Prevention and Resiliency Program Coordinator here in Carroll County. And I am going to share with you about the Resiliency Program. You want to go to the next slide? So the Resiliency Program on a very broad level is, again, it was designed to provide these drug-free and alcohol-free structured activities and events for young people to really engage in learning and practicing healthy coping skills and different positive skill building techniques. The resiliency program was designed to prevent overall the decrease in substance use, and that's how we kind of fell under that the alternatives strategy. But not only like does it reduce the substance use, it helps kind of mitigates the impacts of adverse childhood experiences. It promotes those healthy behaviors, provides positive peer-to-peer opportunities for engagement. And how this began, so we started back in 2022, which was about 1 year before I came into this position. And it started with really just a good relationship with our local Boys and Girls Club here in Westminster in the central part of our county. So we paired up with them, and they already have like a bunch of different clubs going on there, different, skill building activities and things like that. So it was kind of like we partnered with them in those different clubs. Now, I do believe Knitting Club was developed specifically for this, for resiliency program, which I'll tell you about in a second. Next slide. I'll keep talking if I'm not clicking. So resiliency, again, it's a skill, right? We're trying to teach youth how to build this skill throughout showing empathy, giving the sense of belonging, learning to accept help, learning responsibility, having that one trusted adult, expressing their feelings, developing friendships and shared interests, self-discipline, and many more skills. But I see resiliency as like the new approach to substance use prevention, really. Next slide. It really took a lot of, help to make this work. So our collaboration to make all this effort possible, we had to work together again. We started with Boys and Girls Club, just the one location here in Westminster, and that eventually began expanding. So we expanded to all the Boys and Girls Club locations throughout the county, which there's 5 total. Actually, I think 6 now with North Carroll. And then, of course, Bert has been so helpful. I mean, they've been like our go-to right hand, helped with a lot of this, and I can't give them enough kudos. The public school systems, we've been in partnership with them as well. And you see the logo in the middle. We actually got with a consultant, and they developed this for us, a graphic design consultant, and they developed this logo for us, really to kind of like, yes, this is a program that's specifically for right now. Unfortunately, it's only for the Boys and Girls Club, but there's definitely plans to expand, and I'll get into that later too. But I love our logo because it's really like, it's like how we kind of spread, throughout the county, right? We want the whole county to be resilient. We want to spread resiliency throughout the whole county. And together we can find a way, which is kind of something they came up with. So love that. Next slide. So the goals, to decrease substance use in youth, we've provided youth with the positive peer-to-peer opportunities, right? We've held different activities, including the clubs. I'll show you all the different clubs in just a minute. But aside from the actual clubs that we've been holding, we've had these kind of like pop-up events, which is my favorite term recently here. These pop-up events here and there, just throughout the county, right? If something were to happen, it's nice because we can kind of implement this throughout a lot of the work that we do. So like, for example, not recently, it was a little while ago now, but we had several suicides happen in one town in our county, like within a couple days span. So we had this resilience pop-up event where we just went out there. We showed, that we were there. We showed our support for this specific community. We had developed like a little activity for them to complete, the resilience tree, right? To focus on their strengths, to bring the community together. And yeah, I mean, it was really cool. We didn't have the greatest turnout because it wasn't a big event, but we partnered with the sheriff's office and the local like town government. And we had a few people show up and they, put their leaf on the tree, which I'll show you pictures of that later. It's pretty cool. But our goals, again, we want to increase those protective factors. We want to increase those safe spaces for youth. Overall, this is building the community together. The data collection, again, Bert has been so helpful with all of our data collection. We've been really good about, trying to continue to improve our data collection methods. And then the actual skill building, right? So what it is, we can go to the next slide. What the resiliency program really is that we have paired this hard skill and a soft skill, if you will. The hard skill being our first 3 initial clubs were knitting club, gardening, and a book club. And what we did was pair that with the soft skill, right? So the kids learn how to knit while they're learning. the leader, whoever that may be. Now, of course, it was us going in there at first, but we are only one person, so we can't be everywhere all the time. So we had to train, Boys and Girls Club staff to kind of take the lead as well, and just to talk about whatever that coping skill was. Now, when we first started this, we didn't really have like a specific guideline to follow. So we were just kind of, picking and choosing what skills we wanted to work on that week. And sometimes we'd leave it up to the kids, right? Sometimes we would ask them what's going on this week, something we need to talk about, and just kind of go from there. But more recently, I'll show you in a few moments that we've really buckled down on like the structure of this program. Next slide, sorry. So this is our knitting club. We have, 5 locations. I'm sorry, 5 locations. 5 Boys and Girls Club locations, and then each of those locations have a certain number of meetings each year. Now this was last year's data. Westminster, we had 11. Tawnytown was around 10 meetings. Sykesville, 11 meetings. In total, there's about 36 participants in all of them. This is a little smaller. Not a lot of people more kids weren't into knitting, I guess. But the ones that were really into it. And it's really cool to see them learn this new skill and just kind of bond over it. One of the pictures you'll see, this was, several years ago, Governor Logan was there, and the kids came up with their own 10 knitting rules for life, right? So we ran with that too. We love them. We're thinking about doing like a bookmark with those because they're just so good. But just like kind of cutting themselves slack, giving yourself enough slack, right? There's very cute terms that could, apply in knitting and in real life. And they came up with their little 10 rules. So that was cool. Next slide. We have book club, right? So this was at all locations, all the Boys and Girls Club locations. This was kind of more mandatory. So you'll see a lot higher number here, 242 teens. And we were able to have like a book fair, right? A little pop-up book fair for the kids. That was really cool. They got to go around and choose what books they wanted. And then the teens actually went through this book. What was that book called? The Highly Effective Habits for Teens, 7 highly effective habits for teens. And they went through each habit, and they studied each habit each month. So they had their meetings every month, and we actually were able to kind of coordinate with them and do a lot of extra stuff around that book as well. So that was really cool. A lot of our lessons were kind of focused on that book when they were reading it. And we've had little pop-up book fairs here and there at different Boys and Girls Club events that aren't necessarily resiliency program related, but we just show up. Next slide. We also have the gardening club, and that is really cool. Actually, last year we got to bring out Tony Hillary. He has this nonprofit in Harlem. It's called Harlem Grown. He has a book he wrote, and he basically just started with this one school in Harlem and was like, let's start a garden. Let's start a community garden. And it is just blown up. I mean, it's expanded. He's got like so much, so many more gardens now. And they have these, what are they called, hydroponic gardens where they grow up because they're in New York City. So there isn't a lot of green there. So it's really cool how much he's expanded his as well. And we actually had him come out to our local, in Carroll County, we have our local Risky Business Conference every year. And he came and spoke at that this past year, if any of you were there for that. Next slide. So the kindness walk, this is something else. This is, again, one of those little kind of like pop-up events we've done. So this is how we've partnered with the schools. It's one of our initiatives just to try to connect with all of the Title I schools in our county. So we were able to collaborate with Tawnytown Elementary School and had a kindness walk last year with them. We ended up having a good turnout. There were about 125 participants. We were able to provide like healthy snacks for everyone and water. Again, you'll see the one picture, we had our resiliency tree activity. The kids would put up, right on a leaf, something that gives them strength or something that, helps them. And then they stick it up on the tree, and then we give that tree to them. They keep it, put it up in the school or wherever. And that's something we've been able to do here and there at the pop-up event I told you about. So this was a kindness walk. Now this was around the 8 dimensions of wellness, and they had to stop at each part of the wheel and do an activity for each segment. So that was really cool. And it was such a great turnout that we insisted on doing it again. So I'm partnering with Tawnytown again to do it this year. It's supposed to be this April. So I don't have any pictures from this year, but this was last year's. And then we actually just had one, next slide, I think is the next slide. Yeah, that we just had another kindness walk held with Robert Moton Elementary, where we had a total of about 52 attendees. So it was a little bit smaller. And this one I added this slide in last minute, Nicole. I'm talking on the wrong thing. Sorry. We just had another one. We had another one with another elementary school, which is also another Title I school. And that was pretty cool. They were able to provide pizzas through their PTA. So that was a little mix and match. We partnered with them as well. Evaluations. So again, I can't thank Bert enough. We have we had Bert help us create this large survey that we started to give this out in the beginning of the resiliency program. We would give it out in the beginning of the year, and then once again at the end of the year. Now, we only had this one survey for youth at first, and Bert helped us create all of that from start to finish. And there was, ways to identify what club the child was in, the youth was participating in, what Boys and Girls Club location they were at, so we could kind of narrow it down and look at, all those different demographics. Next slide. All right. So the evaluation plan of the resiliency program collected process measures and outcome measures. We measured the impact. We collect the data to assess the changes in the youth's knowledge and attitudes and the skills around engaging in healthy activities. Additionally, data collected was assessing to what extent does the resiliency program produce or contribute to the intended community and the system outcomes to address the use of multiple substances in Carroll County. So we're not only measuring, their skill. How do you feel about your skill in knitting? Have you gotten better? But also, how do you feel about, your positive coping skills? We'll measure those as well. Do you feel like knitting is something that you can do when you're upset? Does it help you when you need to get away? Or does it help you when you need to take a minute to, have a breather? Measuring how this skill is actually helping as well. Next slide. Limitations of the data really was just the sample of program participants at first. When we first started, still now we're still trying to wrap our hands around this and our data collection methods. I think with our new plan, which I'm going to show you, I'm really excited about, our new plan this year is really going to help with these limitations. I think it's really going to be a better method of collecting everything on a regular basis. Next slide. Yeah, again, our next steps for evaluation, we're going to collect all the data. That's the plan this year. We're trying to collect all the data. We have different evaluations now. So we have our main survey that we used last year that we would give in the beginning of the year and the end of the year. But now we also have evaluations for each club and skill as well. So the participants will fill out, not every club because they meet weekly. Some of them meet weekly, some of them are monthly. But they would only do these evaluations probably once a month for those that like meet weekly. And that's what's going to actually measure specifically on that club and that skill and what they've learned. And our bigger survey that's given in the beginning and the end of the year is more that asks a lot more about like the substance use, and do you feel like you have a trusted adult? Do you feel like you have options other than drugs, something fun to do other than, unhealthy behaviors? Next slide. So some of the lessons that were learned, again, we just needed a more solid data collection method, I think. So we determined that it was best to kind of have that one larger survey in the beginning and then one at the end. As for the lessons themselves, again, they're once a month. We meet. I am going to start meeting with all of the adult leaders at Boys and Girls Clubs monthly, whether that's online or however, just to kind of get them all in one place and kind of gather their information and just say, how's everything going? Are you able to collect all the data? And really, we're developing this system that can be practiced anywhere. I mean, like, my dream really is for this to become like an evidence-based program and to be shared anywhere. I mean, because really it's up to the kids what skill they want to learn. They can choose whatever they want. And this year, actually, some of the successes that we've had are kind of expanding the number of clubs. So this year we have not only the knitting and gardening and book club, but we have this art club or cricket. They're using the cricket club. We have a cooking club. We have this Smart Girls Club, which is, I forget what SMART stands for, but it's all girls. They have the girls and the boys club, but we meet with both of them. And they just talk about, gender, things that apply more to their gender, I suppose. But again, one of the challenges, the staffing, we're, very limited here. So we can only be in so many places at once. And that's why this newer organized version was really needed. I'm going to show you a preview of it. It's still not officially approved, but it's completed. And I'm really excited to show you our new resiliency program guidebook almost.
Can we just jump
So
to the?
oh yeah, I'm sorry. Looking into the future, looking into the future, we're going to try to implement this in more schools. If we can try to get our way into the schools now is through like the PTA, through the Judy Center. I don't know if that's a statewide thing or a countywide thing. The Judy Center, and again, I said through those Title I schools, they get like additional funding. So we were able to kind of partner with them. But I would love to get this into like DJS, DSS, different behavioral health agencies around the county that serve youth. And ideally in all the schools, middle schools, high schools, elementary. Right now we're primarily like middle high school age. That's the primary ages that we deal with. But again, the Westminster Boys and Girls Club location has elementary school students as well. So we work with them sometimes. All right, next slide. Here it is. All right, so this, you don't have to go through all this, Nicole. I just put like a bunch of the slides of our new guidebook. So this is our new resiliency program guidebook that we just created. Bert created for us. Remind you, this is still under review, so it's not technically approved yet, but I did want to just give you a sneak peek at like how creative they are and how awesome this is. It has the introduction. It just kind of tells you about the program in the beginning, the goals. Yes. I literally just gave them this information and pictures, and they put all of this together. It was really, really cool. So the new updated version of the resiliency program is this 7 C's. We have added the 7 C's of resiliency to our program, and it's really just a more, it's more guided, it's more structured, it's evidence-based. So the 7Cs model, it offers this common language across disciplines that could be a very important step to breaking down these silos as we work together to prepare our youth to thrive. You'll see the different lessons. So these lessons we can kind of break down. We give these to the adult leaders, and they can follow these easy to follow lesson plans, right? They just follow this lesson. Here are your objectives. Here are the guided questions you can ask the kids. What any questions or concerns that might have come up. So these are kind of like evaluations for the teacher, for the instructor. We also have the evaluations for the participants as well. So they can kind of rate their own lesson and say, you know, this was how things went. I thought I had some more notes here. So the 7Cs, I'll just give you a quick history. Initially, it started as the 4 Cs. It was competence, confidence, connection, and character. And then later on, other research and practice stressed using 5 Cs, which included contribution. And then the last 2 Cs, to make it 7, were coping and control. Now, these were added by the founder of the 7Cs, Kenneth Ginsburg, in 2006. I've actually emailed Kenneth, Dr. Ginsburg, and just told, you know, fangirled him and told him how much I loved his work, and, you know, asked him for more information. And he recommended his book. He actually published, it's called Reaching Teens. It was published by the American Academy of Pediatrics. This has like been my new go-to. It's just literally right here on my desk, so I'll show you. It's awesome. It's a strength-based, trauma-sensitive, resilience-building communication strategies rooted in positive youth development. And it's everywhere from helping very specific populations like children, military families that move a lot, compared to substance use, to, you know, trauma, any trauma-informed care, things like that. It's awesome. So this has been really helpful. This has kind of been my guide as I kind of created these 7Cs and these lessons around them, and the questions to ask the youth around each 7C. But having, you know, just these positive coping strategies, right? This is going to allow the youth to manage stress without turning to other risky behaviors. So that was the overall kind of guide for that. I'm just really excited for our new takeoff. And yeah, my information was on the last slide. If you have any questions, that QR code should still work. That takes us to like a 1-pager on the resilience program, what it is, and more about that. So any questions?
Becca, any questions from the audience?
I don't think so. Congratulations. Thank you. All right.
There's a lot to take
Thank
in.
you.
So
It was a lot. I'm sorry. It was a lot.
No, it's okay.
Take your time on questions. If you guys come up with something later, you can always email me too. It's been a lot in the works, and it's still evolving, right? I think that's the most important thing, is that like we don't want to just have these one events that we can do each year or whatever it is. I mean, I want it to grow so that it can continue on, even, you know, past my time, and continue on as a program in other places as well. So.
Great. Well, we'll bring you back at the end. So but thanks so much.
Thank you.
And I'm going to move on to Montgomery County.
All right. Good afternoon, everyone. Ben Stevenson, Acting Manager of Prevention and Harm Reduction Services with Montgomery County. I see Nicole and Raina has put me in a tough spot trying to follow those 3 amazing programs from Lynn, Kirsten, and Rebecca. Y'all are doing great work in your communities. I commend you on that and everything like that. So I'm just going to share about us developing, a youth coalition in Montgomery County. Mainly, I've been wanting to do something like this for quite some time. And we finally got to a place of getting it started. But we, definitely hit some bumps in the road. So we can go to the next slide. So here I'm just going to share some foundational work and understanding like the impact of the program, some implementation. So looking at what our youth ambassadors are doing as far as their initiatives and strategies. We'll talk about evaluation, successes and challenges, as well as future plans and recommendations. Next slide. All right, so we can go to the next slide as well. So just kind of laying the foundation. Um, we, looked at a lot of data back in, I'm going to go back all the way to 2017, looking at data from, different spaces and things like that. But what we really found a lot of information from was from our focus groups that we conducted and learning from young people about, the fact that there weren't opportunities to kind of necessarily get involved in like prevention work or educating their peers or doing things like that. And so we kind of wanted to, build that space for them to be able to, share their voice, to educate their peers and also to increase their knowledge themselves. But to, help that to kind of manifest in other different spaces. Next slide. So from that, our 2017 needs assessment, we kind of outlined like underage drinking, cannabis, and non-medical use of prescription substances were the main concern for young people. And our risk factors from that assessment, we determined, community norms favorable for substance use, low perception of harm. And then our protective factors that we kind of looked at was opportunities for engage in school and community, which we kind of built this program out of, as well as positive norms. Next slide. So our goal for our youth program was built around trying to develop youth skills around advocacy. And so our goals for our youth ambassador program was to increase the number of youth who wanted to advocate for policy changes, and to increase, their knowledge, but also their peer knowledge. To also increase number of youth actively engaged in leading conversations around substance use. So giving them those opportunities to, share their knowledge and information that they have learned with their peers, increase in support for youth involvement in policy changes. So making sure that the youth had spaces to actually advocate for themselves amongst leadership. So having opportunities to kind of speak in front of like school system leadership, whether it's a school board, superintendent, or even like our county council. And then also increasing in number of activities or the intensity of those activities that involve youth to accomplish policy change. So we go to the next slide. So I returned to the county back in 2019. So I had the fortunate opportunity to do some work with CADCA. And from there, in addition to the work I was doing with them, I had, taken upon myself to really learn the work that they were doing about their youth leadership initiative, and understanding the importance of it being youth led but adult guided. And so making sure that whatever I built once I came back to the county, that I wanted the youth to lead it. I wanted them to be an intricate part to ensure that they understood that we didn't want them to be at a table where adults are kind of talking at them, but that they're actually equal members at the table. So in 2019, we initially started with a couple of community partners. There were a few community-based agencies that wanted to partner on the initiative to kind of build youth coalitions at all of the schools. And that was, a very lofty goal because if you are aware of how big Montgomery County is, we have 26 high schools and 40 middle schools. And so trying to reach every high school and middle school posed a challenge because if we were looking to build SAD chapters at all of these schools, we would had to have had a staff sponsor to lead those SAD chapters as well. So when COVID hit, we kind of backed up a little bit and basically kind of punted, and tried to figure out a way to still get young people engaged, but also partner with the current SAD chapters that I think there were like 9 out of the 26 high schools. So we partner with them in regards of identifying young people initially, to kind of help us get started back in 2020. Even though it was during COVID, we met, virtually and things like that. And those youth kind of helped me to kind of figure out how we could um, set the youth ambassador program up, so they had some decent insight. So we met a couple of times, but it wasn't officially started because I was trying to figure out a way to make it perfect. But I understood that it wasn't going to be perfect, and that hey, we needed to go ahead and get started. So in 2021, we formed a small advisory group of the community-based agencies, and we started recruiting young people. So we partnered, of course, with our school system, also youth serving organizations, and things like that in regards to trying to get a flyer out there to do recruitment. Initially, young people had to email us to say that they were interested in being a youth ambassador. And when they emailed us, we would send them the actual application for them to fill out to be a youth ambassador. So in that initial year, I think we had 7 youth ambassadors that started with our program, which was I was just happy to have one, but we ended up with 7. Um, those youth ambassadors, we kicked off our first meeting that January in 2022. And so those youth ambassadors pretty much helped in regards to laying a lot of the foundation of what the youth ambassador program is today. So next slide. So again, we made sure we build capacity in regards to partnerships with community-based organizations. We work with our membership of our Montgomery County Prevention Alliance, which included like members from the PTA associations, partnership with other organizations. The school system, of course, was a key partner in regards to connecting with like school counselors, and pitching the idea of the youth ambassador program and trying to ensure that youth were aware that we could provide service learning hours, which of course they need for graduation. We also partner with our suicide prevention coalition, and then of course established that small advisory group as well. So next slide. So it was important for us to develop this youth model, because we knew peer-to-peer education was like very valuable in regards to just leveraging like those strong influences, also giving us an opportunity to kind of build up the skills of the young people, so that they could share their information or share that information with their peers about health and well-being, positive life choices and things like that. So we wanted to, of course, increase that engagement from what we learned in our needs assessment. We wanted to improve accessibility. So initially, we wanted to have meetings in person, but we, of course, during COVID, we learned that virtual was the best, and we still currently meet virtually. Virtually, we wanted to make sure that the program, built skills. So we have, professionals come into our meetings from time to time based on the request of the young people. So they pretty much guide who our guest speakers may be. So we've had, therapists come in. We've had persons in law enforcement, persons in, general public health fields and things like that. Because again, we also wanted to give them opportunity to get exposed to a lot of the different fields within public health, and as well as trying to get them exposed to prevention, because of course I don't think any of us actually well, maybe now, but I know I did not go to school to work in prevention, but something I learned over time. And then we also wanted to empower them and develop ownership of the program. And then we just kind of felt this was a cost-effective approach because it wasn't a lot of costs associated with it. Next slide. So again, we wanted to develop a youth-led but adult-guided program, and the youth basically came up with our mission, our statement. So be the one is a movement to empower young people to use their voices on topics that impact them. The program, was initially started to address suicide prevention, but we, have grown to address substance use, misuse, as well as, overall mental wellness. So, and we seek to grow members, leadership opportunities, advocacy opportunities, and in addition to opportunities to do community service. Next slide. So again, the youth developed our mission statement. It took us a couple meetings to kind of get that nailed down. So we had a professional come in and help do like some wordplay and things like that. And so we got to this place of, being the one youth ambassadors program is designed to be youth led, but adult guided. And I won't go through all of that language. And then the vision, of course, is to help youth reach their fullest potential through creative and innovative opportunities to impact the community. Next slide. And so, with some of those initiatives, our strategies and initiatives that have been youth led, so on an annual basis, they've been requested to lead youth breakout sessions at our ALDAC and MHAC spring forums. So they'll do that again this year in May, which be in person. The past two have been virtual. Typically, in those sessions, they will take the youth through a session where they kick it off with a oh gosh, I forgot. I don't forgot. I'm gonna come back to it in a minute. So they'll kick it off with with a meditation. In addition to the meditation, they go through talking about signs and symptoms of substance use or signs and symptoms of mental health. And coping skills and coping strategies that may be used to kind of help, mitigate some of those challenges that young people may face. But then also taking young people through our Be the One 5 steps. So trying to educate them on, asking their friend or inquiring with their friend about what might be going on. Being present, for their friend, connecting them with a trusted adult as well. In addition to that, our youth ambassadors also had the opportunity to work with school board members, our formerly medical director within MCPS, as well as other youth on advocating to change MCPS policy around carrying naloxone in schools. So at one point, youth would get in trouble for carrying naloxone, but that policy has since been changed, so youth can carry, knowing that they might be the ones in a position to save their friend's life before someone else. We've also, in addition to prevention, also am the naloxone training manager. So I've taken the youth ambassadors through a trainer of the overdose response training. And also we've drilled it down so they're not necessarily getting the long adult training where we cover data and all these other things that may not be interesting to them. So we kind of drilled it down to kind of focus in on signs and symptoms of an overdose, how to respond to that overdose, and how to administer Narcan. So our youth ambassadors actually lead those trainings on a regular basis. Last year, they presented at the Save a Student Summit, which they trained about 148 students. This past January, they trained at the same event, which they trained 296 young people at that event, and we dispensed Narcan at both events. They're also been leading, roundtable discussions during Teen Mental Health Week in partnership with our public libraries. Hosted resource tables at their lunches, so some of the young people will approach their administrators in partnership with our, my team or myself, and we'll, set up resource tables at their school lunches, and they'll, during their lunch, they might come and work the table for a little while as volunteers. And then we've also volunteered at MLK Day of Service to lead volunteers in Narcan assembly. So the youth ambassadors kind of have helped support that. In addition to leading group mindfulness sessions, as well as putting posters up in schools. Also hosted movie nights and things like that. We brought in professional speakers, educated around 988. And then they also have had the opportunity to inform our media company around our media awareness campaign. So the media company actually comes and meets directly with them and gets all of their insights and thoughts. And then they'll go back and put together messaging that will be appealing to young people. And so they really enjoy that because they get to see, their words and imagery kind of, come into fruition. Next slide. So here's just some images of some of our youth ambassadors. I was fortunate enough to take 3 of our youth ambassadors, which is in the middle to the CADCA National Forum this past February. We actually had the opportunity to meet with Senator Van Hollen's office. So they were able to meet with some of the staffers there and advocate for the importance of, funding prevention initiatives, also supporting, funding for the Drug Free Communities grant as well. And then they were also able to share, some of the work that they've been doing and some of the things that they would like to do within the community, like, in addition to what they've already been doing. Here you can also see, at the bottom, it's like pretty much almost a full room of young people and community members where youth ambassadors were leading Narcan training as well. Next slide. So some of the modifications are that we had to really look at when establishing this program was yes, we wanted to have prevention groups at every high school, but I think a couple of others kind of alluded to staffing challenges. So initially, I started with we had 4 or 5 advisors, and I don't know what happened. They started to just fall off at due to other commitments and things pulling them away. And so I just felt compelled that hey, we started this, so we have to keep it going. So I've been kind of running the youth ambassadors myself for the past 2 years, but I've recently been able to reallocate some staff to kind of help out with that. So and then we made that decision to just recruit from every high school in the county. Next slide. So our evaluation, so we looked at, of course, processing and outcome evaluation. And before I go into that, we do have, so out of our 26 high schools, we have representation from 11 high schools, 1 middle school, and we have representation from 1 private school. And we currently have membership of we have 53 members on our roster. Of course, not all 53 members come to every meeting, but they have all kind of participated in various ways to kind of help support youth ambassadors in the program. So evaluation. So we just look at process. So to what extent was YAP being delivered and received. So we meet on a bi-weekly basis. So we meet every other Tuesday from 6 to 7 p.m. We have a co-chair model. So I have 2 co-chairs that lead all of the meetings, and I help support them in regards to putting together their presentations. We also have 2 administrative support. So their main role is to kind of support the co-chairs, but also do the attendance for every meeting. And then we also have 2 members that are our membership chairs because we put the responsibility on the young people to recruit other young people because we felt like it's only going to become as big as they build it. I always talk to them all the time about, hey, Mr. Ben loves to come out to the schools and recruit and get young people, but if you're recruiting, then it could, be a lot more sustainable, and your peers will see that you're passionate about this initiative, and then also just making sure that young people they have everything they need in regards of recruiting. So we practice recruiting in our meetings from time to time as well. In addition to that, we talk about how many youth are engaged in the youth ambassador program, and then for outcome, to what extent the youth ambassadors contribute to youth knowledge about mental health advocacy and the dangers of substance use. So that's just a little bit of our evaluation, and working with our evaluator. They typically come in at the beginning of the year, and we utilize our youth ambassador kickoff meeting as like a focus group kickoff. And then they'll come back again near the end of the year to do like a follow-up. Next slide. Okay, and so successes. So we've seen annual increases in membership. Just like I said, our first year we started off with seven members, and and now we're at 53. And we've also seen increase of representation for various schools. Youth actively taking the lead on projects and initiatives. So it's more so them contacting me and say, hey, Mr. Ben, we would like to do this. What do you think? And me just kind of supporting what they would like to do in regards of reaching their peers and things like that. County leadership is beginning to view youth as a source of solutions and wanting them at the table. So they've been constantly getting invited and requested to come to meetings with leadership to speak on, from a youth perspective or sharing insights and their thoughts. And then just again, like the youth were a key piece in changing MCPS policy. So unfortunately, our school system lost their uh, medical director's office, which kind of helped shift the thinking of the importance of Narcan in schools, and also shift the thinking of youth carrying Narcan. And so the picture there is just something she has shared on her social media about some of the work we've done in the county, because ultimately the goal is to have representation from all 26 high schools as well as all 40 middle schools, and to kind of build a pipeline of young people having that same message that it's okay to be substance free. Next slide. So the challenges and lessons learned. So COVID, of course, posed that challenge, with I think we all were impacted with that around recruitment. Um, Starting small is okay. So my goal was to, knock it out of the park at the beginning, but understanding that, stepping back and allowing it to just kind of grow organically was important, and then getting adults to see the importance of having youth involved. And I think over time we've been able to do that, and they see the value of the youth voice in our prevention work. Next slide. So our future plans. So have YAP representation from every high school. Start outreach to middle school students to begin, that pipeline like I was mentioning. In the upcoming fiscal year, so not this fiscal year, we want to host a youth leadership summit in the county that'll be led by the youth ambassadors. And then recommendations for those who might be starting. I always say having multiple adult advisors to support is important, just because, we can all, a lot of us get busy. So being able to lean on another adult that can kind of keep things going. The Having the youth officer model, I think, has been a great asset, because the youth, they develop all of our, presentations for our meetings. They work on agendas. They recruit young, other youth and things like that. And then also having a sustainable recruitment plan. So just like I was saying, I can get out to schools all the time, which I love to do, but sometimes my schedule just doesn't allow me to do that. And so leaning on the youth to do the recruitment and lead the recruitment efforts, I think has been helpful. And then allow the youth to lead. So truly believing that nothing about us without us. So letting them to lead from the beginning versus saying, hey, this is what we should do or could do. Next slide. I think it's just questions, and then my contact information. So that is the youth ambassador, the Be the One Youth Ambassador program in Montgomery County.
Thanks, Ben. The one question that was in the chat was, right, are you able to dispense the Narcan in the schools?
Yes, we are. So, in partnership with our school system, so we worked with our school system to become an overdose response program. So they are their own program. So they actually only work on supplying Narcan to their schools, but we have MOU between HHS and the school system to dispense within the schools as well. So when we're providing like those large scale trainings and things like that, we will dispense Narcan to young people as well as their families that are in attendance.
Thank you. Anyone else? Any other questions for Ben? People, no. Also, everyone, I'd like any of the presenters like to come on camera, and I'll stop sharing and let you guys, just so everyone can see you, to be able to ask any questions that anyone might have. I don't know if there's a lot that was taken in. Anyone, any other questions from the group?
I'm just gonna assume we
Any
did an amazing job since there are no questions.
Yeah, and I was like, if there's
Yeah,
any
yeah.
questions you guys have amongst each other, since you all are working with youth, anything that you guys. Oh. Yep, go ahead, Toya.
Yes, hi. I do have one question. Here in Baltimore City, we're not able to actually dispense Narcan to the students. Before they could not carry it throughout the school, and I know you said now that they can. Are you able to actually dispense it in the schools, or is it just at outreach events?
So, so specifically thinking of like our Save a Student Summit, in addition to like them, receiving Narcan training at that event, and it happens in a school. So the schools host that event in partnership with youth serving organizations. And so in addition to the Narcan training that happens, there's also additional breakout sessions that happen at that event. There's resource tables, and then they do in partnership with the state's attorney's office, there's a student video contest where the awardees of the contest get, their prizes and things like that. And so it's in the school, and once the event is over, we dispense at of course, the knowledge of school leadership and things like that. So we haven't had any challenges or pushback from any administrators or central office or anything like that, because they're actually on board with making sure young people have access to it. So it's been helpful to have those partners within leadership to see the benefit, because I think we had an incident in the county where, and this was before the policy was changed, but a young person overdosed in a McDonald's bathroom near one of the high schools, and their friend had Narcan in their backpack and saved their life until EMS got there. And then, the school system said, well, now let's really look at changing this policy. So I think them understanding the magnitude and importance, and the importance of empowering young people in this space has been tremendous in regards to helping to change policy, but also just empower young people.
Okay, that sounds great. Is there any way I can, I guess at the end, get your email address? Because we do a
Yes.
Kids Off Drugs program, whereas though we go to individual schools and teach the kids. We touch on Narcan, but because we can't dispense it, that's the furthest we go within the presentation. But I would love to figure out how
Yeah.
we can partner with some of the schools and get everybody on board to actually dispense it to the students during that program.
Yeah. Also, our public health officer um, adjusted their dispense protocols and allowed us to dispense to persons 12 and up. And so that also helped in regards of when we had that medical director within the school system, it helped kind of facilitate some of those connections to be able to dispense in the school system as well. So a lot of the events we've done in the schools have been in partnership with that medical director, and they've been 100% on board with us dispensing. And now with the loss of that medical director's office, a lot of that role and responsibility has shifted to like our director over, I think, school psychology, and they're still on the same wavelength in regards to trying, being able to dispense the kids as well. So, yeah. So sure, I'd love to talk to you about that.
Okay, perfect. Thank you.
Looks like there's a lot of interest on how to get that in other jurisdictions. So maybe we can even have a follow-up of how that can happen.
I had a similar question about because from what I understand, you mentioned earlier that the schools or the like Howard County Public Schools is its own overdose response program separate from the health department. Is that correct?
Yes.
Okay, so I would just also and I have a couple of questions. It'd probably be easier if I just got your email address.
Feel
I'm
free to ask
Howard
right now. You can
County.
ask a few.
Well, someone else probably has your same question.
Yeah.
Okay, and the person who spoke previously, she did have a couple of my questions as well. I'm a naloxone trainer with the Howard County Health Department,
Mhm,
and we do trainings at some of the schools.
mhm.
And we are able to dispense to people. It could be students, teachers, faculty, parents when they attend the trainings at schools. But we're trying to have more of a, I guess, a concrete partnership where potentially Howard County Public Schools could also become or could also have their own overdose response program. So I guess I just had
Yeah,
general questions about what it was like kind of building that program.
yeah.
And you mentioned maybe because of the overdose at a McDonald's close to a high school, that kind of got the ball rolling. So what were the steps? You know, I don't know if that's too general of a question, but what was
Yeah,
the
no.
timeline of that
Um,
overdose?
yeah, so initially we were so in addition to doing prevention, I oversee our, harm reduction, which is the overdose response program and training and all of that. So um working with the school system, they were one of our biggest requesters of naloxone. And so that was them wanting to make sure that they had naloxone in every elementary, middle school, and high school. And
Okay.
so with us trying to make that happen, I want to say that that was probably 2022. And it was between myself and three other staff members to try to take or drop off naloxone to every high school, middle school, and elementary school in the county. And so, of course, naloxone expires. And I approached the, medical director's office and pitched the idea, and they, said it makes sense. So I help support them through that process, which is an easy process to become an overdose response program, where they, I think they got their approval within like 2 days, and that just allows them to order their own naloxone and dispense it on their own. But their focus has only been on making sure that they had naloxone in the schools for their staff. They don't dispense to the community, so the
Okay.
task for the community still rely falls on us,
The health
and
department.
that includes students and parents and caregivers and things like that. But
Okay.
they, eliminated that pressure on HHS to dispense to all of the schools.
Yeah.
So we still, work in partnership with a lot of our private schools in the county in regards to making sure they have Narcan and stuff like that. But at one point in time, HHS was just inundated with a lot of requests and a lot of demand that we just could not fill in a timely manner. And so it was important for us to kind of build up the capacity of ORPs in the county. So now we have 8,
Oh,
which
okay.
includes not only HHS but also our fire and rescue partners. So our fire and rescue has naloxone in all of the fire stations in Montgomery County, and initially we were supplying all of that before they became an ORP, but now they're an ORP, so they can order their own naloxone and dispense it on their own as well. We just help
Okay.
them with Narcan kit assembly because everybody wanted the kits to be kind of uniformed and have 2 doses and have the informational cards and stuff like that. But and then there's a few community-based organizations that became ORPs as well. So sometimes even when HHS is not available to do a presentation, we can reach out to those partners and they can go out and do the training and dispense naloxone just as if it was us.
Okay.
Yeah.
Thank you so much for that information. Will you, is your email address already in the chat? Let me see.
No, it's not, but I will drop it in there.
Okay, perfect.
Yeah.
Thank you so much.
You're welcome. Can't spell my name.
Any other questions? Looks like Denise said that there is a proposed legislation bill that's in Annapolis right now to require naloxone education, allow students to carry naloxone at all Maryland schools. So we can follow up with that to see where that stands. And people want to throw in any support for that.
Yeah.
All right, any questions? We will be sharing the slides. You can follow up with any of the jurisdictions that shared today. Rhonda's going to drop an eval in, and if there's no other questions, then we can end and we'll have a great rest of your day, and we'll follow up with sending you guys out the slides and the recording. And definitely reach out to each other. The goal of this peer-to-peer sharing is to let you guys see what what some of the other jurisdictions are doing, and then to follow up and definitely ask questions, see if this is something you can either build off of what you guys are doing, or potentially like looking into as you expand programs in your counties.
Awesome. Thank you, Nicole.